Polyhydramnios, it is a condition in which increased amount of amniotic fluid occurs. Amniotic fluid will be greater than 95th percentile, and the polyhydramnios is defined as amniotic fluid index is greater than 25 centimeter. So amniotic fluid index is greater than 25 centimeter. That condition is known as polyhydramnios. Now, severe polyhydramnios is associated with the fetal abnormalities. If massive amniotic fluid index is greater than 40, means amnioreduction, drainage of excess fluid with a needle is performed in order to decrease that amniotic fluid quantity. So polyhydramnios is associated with diabetes mellitus. If a mother is diabetic, then there are a lot of chances that a baby can develop polyhydramnios, and it needs urgent investigation for glycemic control in order to prevent this condition. So diabetic mellitus mother is more prone or more risk to develop polyhydramnios. Now there are different causes in fetal causes, maternal causes. So the fetal causes include increase in urinary production, can increase amount of the fluid, in maternal diabetes, twin to twin transfusion, and fetal hydrops. Now twin to twin transfusion is a condition in which one twin is transfusing or supplying blood to the another twin. Now the one previous first twin which is transfusing the blood to the second will be oligohydramnic, while the second which is receiving recipient twin will be polyhydramnios. So in this way twin to twin transfusion can give rise to this condition. And fetal causes are inability to swallow amniotic fluid, in duodenal atresia, anencephaly, or neuromuscular conditions. Polyhydramnios can be developed. Placental causes include chorioangioma and arteriovenous fistula. These are the placental causes. Now, the complication for this condition are the preterm delivery, delivery which is occurring before 37th week of gestation, that is known as preterm delivery, and complications are preterm delivery occurs because of excess fluid due to uterine over distension. Preterm delivery can occur because of polyhydramnios. Now, male presentation can occur, abnormal position of a baby can develop, maternal discomfort can occur, and other causes are duodenal atresia is associated with trisomy 21. Now the another condition is oligohydramnios. This is opposite to the polyhydramnios. In oligohydramnios, decrease amount of amniotic fluid which is less than 5th percentile, or amniotic fluid index is less than 5 centimeter. That condition is known as oligohydramnios. Causes of oligohydramnios are renal agenesis, multicystic kidney disease, posterior urethral valve, and strictures. Complications include preterm delivery due to preterm labor rupture of membrane occurs, intrauterine infection, intrauterine growth restriction, and death. Renal death occurs because of renal agenesis and multiple cystic kidney disease. So the oligohydramnios is most commonly associated with the kidneys, because there is less urine production, will be less amniotic fluid. That condition predisposed to the oligohydramnios. So in this oligohydramnios present, now reduced volume is lung hypoplasia, limb abnormalities, clubfoot can be developed because of this condition. And another condition which is vascular related condition is venous thromboembolism in the mother. Now what happens, thrombus is dislodged into embolus, and that embolus vein travel through venous system. That condition is known as venous thromboembolism, and it is maternal morbidity causing agent and mortality in developed countries. Pregnancy is a hypercoagulable state occurs in which clotting factors and fibrinogen level is increased, which causing creation of small clots because of decrease in protein C and antithrombin. Those clots will travel into deep vein, and that is known as deep vein thromboembolism. And when that clot travel from veins into the lungs, that condition will be pulmonary embolism. And pulmonary embolism very dreadful condition. It can create a lot of problem for mother, and the maternal mortality can occur. So in this way this condition occurs. Risk factor are pre-existing factors like maternal age is greater than 35, if a female is obese, or BMI of a female is increased, previous venous thromboembolism, smoking, or thrombophilia can give rise to this condition. Condition that predispose to thrombosis or deficiency in anticoagulants can give rise to this condition. Now, signs and symptoms of this condition are the deep venous thrombosis, unilateral leg pain with swelling associated with the redness and tenderness, and when that thrombus is converted into embolus and travel into pulmonary vessels, and pulmonary embolism develop, then what conditions will be developed like dyspnea will be there, difficulty in gas exchange and respiration, patient will complain of pleuritic chest pain because chest pain occurs, tachycardia occurs, increased respiratory rate with tachycardia, and raised JVP with syncope and collapse occurs because of decreased oxygen supply to the brain. And investigation for this condition will be compression ultrasound of extremity, DVT is performed, DVT deep vein thrombosis for proximal leg vein, and ECG, ABGs, chest X-ray should be performed, and most accurate test will be contrast CT venography. It is most accurate test CT venography. So the treatment will be uh, heparin followed by warfarin should be used started, and both of these can help in prevention of pulmonary thromboembolism. So venous thromboembolism, sorry. So in this way we can manage this disease, and we can save the life of patient, because this is very dreadful condition. Once if that embolism is dislodged into pulmonary vasculatures, pulmonary thromboembolism will be developed, and that condition will predispose to maternal mortality. So the treatment will be warfarin and heparin. So both of these drugs are anticoagulant, which will prevent coagulation or clotting of the uh, factors clotting of the blood, and that will prevent development of embolism.